Hey, are you a speech language pathologist who treats kids in clinics or a school? And if so, do you know how to recognize tongue thrust? Tongue thrust is really common in the pediatric population, but most of us aren't trained to recognize it. And certainly, even if we are trained to recognize it, we don't have the skill set to treat that niche population that is very unique and controversial. I'm Callie Stone. I'm the author of the Stone Tongue Thrust Protocol. And after years and years of clinical treatment with tongue thrust, we created the STTP Training Center, a place where it is all about the parents and the professionals who are dealing with tongue thrust. I don't want you to be that clinician that I was more than 20 years ago, where I had a 14-year-old who came on my caseload as a referral from an orthodontist. He had no developmental delays, no articulation disorders at all, and he was in my calendar on my caseload for tongue thrust. I didn't know what to do, so I reached out to my colleagues, my mentors, and even dug into the research. And what I found was not very inspiring. In fact, a year of therapy and tune-ups. That was the best practice at the time. Unfortunately, fast forward more than 20 years, and it's still very controversial, way misunderstood, and not very effective treatment methods, except for the Stone Tongue Thrust Protocol. We are changing the face of tongue thrust because we identify it, we diagnose, and we eliminate the tongue thrust. So I want you to come and learn more about tongue thrust. Come check out the STTP Training Center. We're going to do a free webinar on July 20th at 10 o'clock Mountain Time. So that'll be noon Eastern and 9 a.m. Pacific time. So you can adjust accordingly, but we're just going to do one webinar to debunk some of the myths, to get you some tools to recognize and understand, what do I do when these kids are on my caseload, and are they on my caseload and it's sabotaging my therapy? Some things that you might, especially in the schools, but you'll see it in the clinic as well. Now the STTP, the Stone Tongue Thrust Protocol, was actually established and developed in a clinic with these kids, just like that first one I had, because you know what happens, right? When you have good outcomes with a particular population, they start to flock to you. And so these kids were not articulation delays. They were multiple orthodontic referrals. So what happened was they would have their first set of braces on, and they'd have the things like the spikes or the baskets, and they'd finally get their braces off, and then the teeth would go back, and they would end up in their second or third set of braces. Those were the kids who were coming to us. And so the original STTP was developed for these kids ages 8 to adult. And that was because that was our population that we were seeing. And so we were following them clinically. We had clinical data, we had follow-up, and all of those things that validate the results. And then I started to train it to my clinicians, and they were able to get those same results. But, you know, times change, and we recognize that, wow, there are some results that really are not typical. It does not take us a year to eliminate tongue thrust, and we don't have any tune-ups. So we get rid of it efficiently. The average is about 7 to 10 visits, and then it's gone. There is no tune-up, but because we actually change the resting posture, we actually change the swallow, and we actually change, if necessary, the articulation pattern. So we do the whole gamut when we address the tongue thrust. So how do we do that? We do it online. The STTP Training Center is an online training center. We were online before COVID, so we know how to effectively deliver training online. And it's not well, we used to do it one way and now we're going to throw it online because you can't show up in person. It is convenient, and when I first did it, I wasn't really sure, but the feedback from our students is fantastic because you get to go back and have access to it, right? So we do things a little untraditionally at the STTP Training Center. You get access to a very skilled clinician who has years of experience, who develops the protocol and teaches it to you and supports you forever. And you have online support forever. So, or at least as long as I'm alive. But I want to join you, or I want to invite you into our world, into the tongue thrust niche, because honestly, there's just a lot of need and not a lot of competent, trained, specialized providers. So I invite you to come and check it out. Is this a fit for you? Is this something, do you have these residual R's on your caseload that you just cannot get? They're in the secondary grades and they're still in articulation therapy. You're over it, they're over it. It's time for a change. I have a hunch we know what's under that residual R. Same with a lateral lisp or a frontal lisp, right? These are those articulation issues that just plague the SLP and the kiddo, right? In the schools. It's so frustrating. So maybe it's not the kids like I saw that have the no developmental delay, no articulation. They're coming in orthodontia, right? We recognize, probably most skilled SLPs recognize a frontal pattern with articulation. So again, you probably see it, but you haven't made the connection that, hey, this is a tongue thrust. And if I treat it as a tongue thrust, and we'll talk about that in the training, if we treat it as a tongue thrust, we're going to have better articulation results. If you're just pounding away at the manner, place, and voice that you were taught and that you have in that skill set, you're going to fall short with a tongue thrust for sure. Okay. So maybe it's the articulation you see on your caseload. Maybe it is the orthodontia referral that you say, oh no, now what do I do? And we'll also talk about in this webinar some of the things that happen. You know, there's this idea that it's just cosmetic, that it's just a forward posture that you see with this open bite. Those are not true. And it's much more insidious than that. It can result in TMJ. It can result in oropharyngeal dysphagia. At this point, a true tongue thrust truly is an oral phase dysphagia. And we'll talk about all of those things at the webinar, okay? So I want you to come. I want you to get some information about, are you able to recognize it? And if you do recognize it, then what do you do about it, okay? And so join us July 20th that's a Wednesday at 10 a.m. So I'm not sure when you're going to see this video, but mark your calendar for Wednesday, July 20th at 10 a.m. and hit your subscribe so you can get in there and get a seat for your webinar right now. All right, we'll see you then. Bye-bye.